The Facts, a discussion series by Cancer Care Services. I am Deanna Stewart, the Vice President of Philanthropy, and on behalf of the entire culture of cancer care, we are grateful for your participation today. Cancer Care Services is a 75-year-old organization supporting cancer patients, caring for caregivers, and empowering survivors to reduce the impact of cancer in Tarrant County. We believe that no one should go through cancer alone, and we exist to be sure that doesn't happen in our local community. Before I introduce Melanie Wilson, our CEO, and Dr. Ann-Margaret Ochs, I do have a few Zoom housekeeping notes for you. Regarding the Zoom webinar, attendees can't be seen or heard. The chat has been disabled. You can use the Q&A to submit questions for the panelists, and we will have 15 minutes at the end for those questions. As far as live transcription, there is an option for that if you'd like. It is not 100% correct, just to be transparent about that. To turn on the live transcription, click on the live transcript button at the bottom and then click Show Subtitles. You should see the subtitles at the bottom of your screen. So here we are, just the facts, the impact of COVID on cancer. Though 2020 resulted in fewer cancer diagnoses, there has been an increase in late-stage diagnoses and cancer mortality. These ramifications will have a lasting impact. Dr. Ann-Margaret Ochs had dreamed of becoming a doctor as a child. She attended Baylor University, where she graduated with a BA in journalism. Her childhood dream was later realized when she graduated from Kirksville College of Osteopathic Medicine. She completed her internal medicine and medical oncology training at Texas A&M Scott and White Hospital. She is board certified oncologist with over 19 years of experience and currently practices with Texas Oncology in Granbury, where she also serves as the area medical director and the lab director. She is a member of numerous medical societies, including the American Society of Clinical Oncology. She's also active in the community and currently serves on the board of Cancer Care Services. She's married with 2 children and enjoys traveling, biking, and painting in her spare time. A quote from Dr. Ochs: "It is an incredible honor to care for cancer patients. I especially enjoy building relationships with my patients while guiding them through their cancer journey." Melanie Wilson is the CEO of Cancer Care Services. Since joining Cancer Care Services in 2010, the organization has expanded its free programs for cancer patients, caregivers, and survivors, including adding new programs like dietitian services, counseling for all ages, including play therapy for children, and specialized support for caregivers and survivors. Financial navigation for cancer patients and survivors was also added in 2020. As a 2-time cancer survivor, Melanie brings her personal perspective to her position every day. She was also a caregiver for her husband and her daughter during their cancer battles. Her 21-year-old daughter, Lauren, succumbed to cancer in 2011. And now I would like to turn the discussion over to Melanie and to Dr. Ochs.
Thank you so much, Deanna. And I really want to give you a special thanks. Ann and I have been friends since we went to Baylor together just a few years ago. It's actually decades ago, but I've known Ann for a long time. So thank you, my friend, for doing this today. It's truly an honor. So COVID, of course, has been incredibly relevant at Cancer Care Services since last March, when we learned that cancer patients were at greater risk for contracting COVID. We quickly closed our office and we transitioned all 33 employees to working outside of this building to protect our clients. All of our services remained intact, but it's been such a difficult experience for our clients. They have needed more resources, more financial services, more support. And Ann, I know your patients have experienced the same thing. So please share with us, how has the pandemic affected cancer care? Let's talk big picture first. How's it affected the United States over the last year?
Well, first, I just want to thank you so much, Melanie, for asking me to be here today. It is my pleasure. I am so thankful that we have reconnected later in life, and am so thankful that I have been able to become a part of Cancer Care Services. It's really meant a lot to me, and it just brings me such happiness in my life. So thank you so much. Um, yeah, so the pandemic has really changed things in the medical world, just beyond belief. It turned everything upside down, seemingly overnight. Um, in every aspect of medicine, but in cancer care particularly, when all of that happened, we were very concerned just about the impact that that was going to have on not only our patients' cancer care, but also what their risks were, being immunocompromised with this new virus that we really knew nothing about. So the changes that have occurred are really changes that are going to be long lasting. And we're really just starting to realize what some of those implications are. So I wanted to go over a few statistics because they are actually really amazingly terrible statistics. About 79% of patients in active treatment reported delays in healthcare. This has been all during the pandemic. We've had these waves in the pandemic, so it wasn't just right when it started, but it was also throughout the next couple of waves, really through about January, February of this year. And so this was affecting all treatment: chemotherapy, radiation, bone marrow transplants, surgeries. I mean, everything came to a complete standstill because all of our resources were being directed towards these patients with COVID who were becoming so sick. So that statistic is alarming. Also, about 46% of cancer patients and survivors reported financial difficulties. As you can imagine, just with a cancer diagnosis, that is a huge financial burden. And then now when you've got the pandemic on top of that, you have hospital costs from being sick, you have loss of job, loss of income, whether that's temporary or even worse, permanent. Kids were home from school, so families were having to feed their kids at lunch and have more groceries available, and so on and so forth. So financially, it's been this huge change. About 48% of cancer patients and survivors reported mental health changes. So again, you already have this underlying, psychological changes that are occurring just with the cancer diagnosis and, having to go through treatment. And then on top of that, you have all of these worries about, am I going to get COVID? Am I going to get sick? Are my friends and family members going to get sick? Are my kids going to get sick? How am I going to school my kids at home, especially when I'm feeling so terrible from my treatment? So all of these things have really impacted mental health, and that has been an ongoing concern. Probably the biggest impact to date has been in cancer screenings. So about 80 to 90% decline in cancer screenings since last year. I have a slide here that is pretty simple, and what it shows is March through July of 2020, and it is comparing to that same time frame, March through July of 2019. And what it shows is in March, you can see a drop in, this is mammograms, colorectal screenings, lung screenings, and prostate. So you can start to see a reduction in March. Then you really see a drop in April. So in April, breast mammograms went down by 85%, which is huge. And then that drop gets better, but continues. And if this graph were to continue out even further in 2020, you would see that it doesn't get any better. And then we have another spike around the holidays, and then you would see that same impact. So for cancer screenings, that's been a huge concern because that's really going to impact us going forward. There's also been a drop in clinical trial enrollment. In oncology, clinical trial enrollment is very important. That's how we come up with newer and better treatments. And when the pandemic started, we needed funding for COVID. So a lot of our clinical trial resources were diverted to COVID and COVID vaccine development as well. So that will be a problem for us going forward. Also, what's really come to the forefront is how COVID and cancer have affected people of color and people who are impoverished. We already knew that there was a problem in these patient populations getting good cancer care or access to that care. And now with the pandemic, that's just like an extra whammy on these patients. And we really are trying to focus more on that and, figure out going forward how we are going to reduce those discrepancies. As of right now, it is still really too early to know long-term impact. I mean, this is something that we're just going to be realizing, as the months and the years go by. But the prediction is that we will see more cancer diagnoses now because they did go down during the pandemic because of the screenings. When we do see patients, they are likely going to be a more advanced diagnosis. And also there may be increased mortality. I mean, for a long time in cancer, we've not had an increase in mortality. We've always either remained stable or we've had a decrease. So now we're expecting to see an increase. Hopefully, we're wrong, but time will tell to, help us sort through all of that.
Well, Ann, that's a very sobering, report. And we see the same thing at Cancer Care Services, and the screenings, that how that will impact when people do eventually, that doesn't mean cancer stopped in 2020. It just means it wasn't diagnosed in 2020. And so when folks do receive that diagnosis and they hear the words, you have cancer, and they learned that their cancer has progressed, which makes it more difficult to treat, as you said, and possibly affects whether or not they're able to survive their cancer. That brings so many additional emotional needs and the financial needs of the pandemic and job loss. And, at Cancer Care, we created a special emergency fund last year to help patients with rent and groceries and things that we just never had to do before, but the need was so profound. We had to just jump in and do whatever we could. So I'm glad that I hope, I should say, that now that screenings are back up, that everybody who's listening to this webinar. If there's something you've been putting off, a trip to the dermatologist or your mammogram, now is the time. Please, please, please take care of yourself and get out there and be screened.
I mean, if you take nothing else from this, that is it, that we need to move on. You know, we need to go forward with our health care and with cancer screenings. And, you know, that's very, very important.
Amen. So what do cancer patients and caregivers, what do we really need to know about COVID now?
So, you know, in the beginning, we were extremely concerned, like I mentioned earlier, because most of our patients are immunocompromised. And, you know, with COVID being so contagious, we were worried about, you know, increased risk for that patient population. I think, you know, we've all been doing the masking and the hand hygiene, and you know, that helps significantly. I think one of the things that we've realized, that has been somewhat comforting, is that even though our patients have been at increased risk of contracting the virus, we didn't necessarily see increased death related to the virus, which was a bit of a surprise, because we really thought that would be the case. So there were some studies that compared patients who had other comorbidities like diabetes, heart disease, obesity, and cancer, compared to cohorts that were, you know, very similar with these other diseases, chronic diseases, but they did not have cancer. And both of those groups really did about the same. So the cancer patients did not necessarily have worse outcomes. So that's been really great, but we still do continue to recommend masks, even if they've been vaccinated. You know, good hand hygiene, trying to stay out of, you know, enclosed spaces with big crowds. So, you know, we are recommending all of that to continue for now. But I think overall it's been, you know, rather positive in that regard.
That's great news. And so is it safe for patients to continue to get their treatment now?
Yes, absolutely. Um, you know, early on, it took us a few months to really figure out our infectious precautions, you know, how we were going to go about all of that. You know, once we were able to do that and we had all the proper PPE, and had all of our policies and practices in place, you know, we've been able to continue safe cancer care, really since last summer. Also with the help of telemedicine, you know, being able to do as much virtually as we can. So yes, and especially now, you know, I don't know, I think it's a little over a third of the population has been vaccinated now. So that's helping. You know, the incidence of COVID is going down now. So all of that is very positive. So yes, especially now, it's definitely safe to continue with all cancer care, you know, all services, whether it's surgery, chemotherapy, radiation, any of those.
That's wonderful news. You know, as a former cancer patient, I can't imagine if um, my chemotherapy or radiation would have had to have been halted. I think that would have been it was already traumatic, but that would have been just terrifying. So I'm so glad to know that cancer treatment is on, people are back. Um, and if you're watching this and you did interrupt your treatment for any reason, please give your oncologist a call, and I hope you'll consider getting back in there. That's how we fight this disease. It takes a lot of attention and care, and great medical attention, and then cancer care services can also wrap around that and provide some of the mental health support that so important.
That is so important.
So, Ian, Is it safe for a cancer patient to get the COVID vaccine?
Yes, definitely. Um, in general, we're recommending all cancer patients, their caregivers, family members that are close to them to all be vaccinated. It is very important. It will definitely help reduce the risk of infection and also the risk or also decrease the severity of the infection. The one thing that we don't know for sure is how our immunocompromised patients are able to mount an immune response. So they probably don't get as great a benefit as somebody would who doesn't have cancer, but even a little bit of benefit from that vaccine will definitely help reduce the risk of being infected. So yes, it's very important for these patients to be immunized, and they don't necessarily have significant reactions to the vaccine, which, we've seen a lot of that in the patient population, that they're worried that, they'll have a reaction and not feel well. But it's not that way. And also these viruses are not live viruses, so you cannot get infected by COVID from these viruses. So they are specialized, RNA generated viruses.
That's interesting. I don't think I've heard that before. I always assumed it was just like the flu vaccine, which gives you a little bit of the flu and your body, fights it. So that's really interesting that they're not injecting any COVID virus in the process. So that, I think, will make people feel a lot better. And I know I'm so grateful that the vaccine is so readily available. And I know that I've seen on the news that the number of people getting vaccines is kind of going down. And so let's just put that little plug in that don't let that happen. Let's keep those numbers up. And cancer community, if you haven't been vaccinated, now Ann has told you that it's a-okay. So please go out there and protect yourself and those you love.
And it is not hard to find a place now to get a vaccine. You don't even have to make an appointment anymore, most places. We are now starting vaccinations for 12-year-olds. So 12-year-olds and up are okay to get vaccinated. So yes, please, everyone get vaccinated, because that will definitely help significantly in the long run.
I went to my pharmacy the other day and they offered to do it right through the drive-through. So you're right, it is very accessible and free. So I hope everybody will do that. So Ann, what do you think the long-term effects, both positive and negative, the pandemic is going to have on cancer care in the future?
Well, the negative effects are, as I mentioned earlier, they're not really known. We do feel like there are going to be more cancers being diagnosed now that people are back to doing their screenings, and that there will be increased mortality. But we just really don't know. What we do know is that medicine is just not going to go back the way it was before. And that can be good or bad depending on how you look at it. I think it's probably a good thing, because we'll be able to, look back and reassess, how our practices are, how our hospitals are. You can get lax at a certain point. And so I think this pandemic has kind of opened everybody's eyes up again. I think we will continue to have infectious precautions. Even once the pandemic is done, I think we're going to be a lot more careful. So I think some of those changes are good. But the bad is definitely that we just don't know what the long-term impact is going to be. Another good that has come out of this is telemedicine. Telemedicine really has a role long-term in healthcare, not just cancer care. But it is a great way to reach patients who have a difficult time coming into the clinic, whether that be because they're elderly or, maybe it's somebody who doesn't have a car or who can't afford gas money. If we can do a telemedicine visit, that helps so much. Or if somebody's at work, they can't take off. If they take off, they might risk losing their job. I've done many telemedicine visits with people who have been at work, on their lunch break or, whatever. So telemedicine is very beneficial. So that will be something that will be a long-term for healthcare, which I think is very positive. And then I touched on this a little bit earlier about socioeconomic challenges, that this is just really an area that needs to have focus. It's been an issue for a long time in healthcare, and now just with the pandemic, it has really brought that to the forefront. So, the American Society of Clinical Oncology, numerous academic centers all have clinical trials that are focusing on people of color in particular. That's an interesting area because it not only has to do with socioeconomic issues, but people of color have typically more advanced and more aggressive cancers too. So there's something that is also genetic that we've been trying to investigate. So between the genetics of the cancer and the socioeconomic challenges, there's a lot to really have to work on there. There are numerous policy initiatives that are being worked on right now also that will, hopefully help with this, but that's going to be a big focus going forward. So it's a negative that we even have those issues to deal with, but it's definitely a positive now that it's even brought more to the forefront, and hopefully there are things that we can do to help with this. And, that's also too where cancer care services can help out is, with a lot of our patients that need these extra services, like Melanie mentioned before, helping to pay the rent, helping get gas cards, all of those things, which some of them can seem like little things, but, if we're all doing these little things, then I think, that really helps, with the big picture. So I think all of that's important as well.
Well, and I'm so glad that you brought up, many things, but in this last section talking about telemedicine. So from the perspective of cancer care, because we want to provide navigation and support, but also we wanted to protect our cancer patients. So like we have learned how to do our cancer navigation and counseling all virtual. We even did our camp for kids whose parents may have cancer. We did our camp virtually. Now this year, thank goodness, we're going to have that camp in person. But it was amazing to see how virtual connection, which we would have never done that before 2020. And we've learned that it's opened up so many new people to get cared for and get the support they need, because they can talk to us like talk to you from their office with the door shut.
Yes.
Or from the hospital room where they just need someone to talk to emotionally for that part of the cancer. So that part has been very positive for us too. We've learned to do our business in many new ways and support. You also mentioned the health equity piece, and at Cancer Care, that's been important to us. We've known the facts for a long time, but now there's so much more information and synergy around solving this problem, not by ourselves. But we feel that there's so many other organizations who are joining with us to really look at what do our marginalized communities need and how can we meet them where they are, not have them come to our beautiful office in the medical district, but how do we get into their churches and community centers? And now we have 2 community health workers, which we didn't know how important it was, and they are out in the communities that need us the most. So I agree, Ann, there's some very sobering things that have happened over the last year, but there's also some innovations and opportunities for us to meet more needs. And that's always exciting, because that's why we both do what we do, right, Ann?
Well, you have to get something positive out of, something so terrible like a pandemic. There just has to be some positivity that comes from that.
Well, that's what we try to focus on. And clearly that's why we've been friends for more than 30 years. I said it, I'm sorry. But you're right. There always is the opportunity in every crisis. And it's been exciting to watch you all at your practice and to watch how oncology has changed. And then for us who do, the financial support and emotional, mental health, how we have changed too. So, when all of these people who were not diagnosed last year do show up at your office, you will know that you can also send them to us, and we will do what we can to support everyone in Tarrant County, regardless of income or age or cancer type. It's great to work so closely with you so that together we can handle the mind, body, spirit, the entire human being. And I think it means a lot to us to have you and to have that partnership.
Well, it means a lot to us. It means a lot to our patients. Clearly it takes a team to take care of people who have cancer. And we couldn't do it without Cancer Care Services. That is the truth.
Well, it's our honor. It really is. Most of our employees have a very personal connection to cancer. I'm not the only one. Most of us have either had cancer ourselves or they've lost somebody very near and dear. Like I lost, my daughter. And so we are in this, this profession out of love and compassion and a deep, deep personal connection. So, Deanna, do we have any questions that have been answered that we can, or asked, and we can jump in?
We do. We have several, actually. So I'm just going to read them exactly as they are. Are there more opportunities for cancer screenings coming up since the screenings went down during the pandemic?
There should be. Now, every institution is a little bit different, but I know that at the current time, everybody's opening up. So I don't know if you're referring to, some of these cancer screenings where they go around the community in a trailer. I'm not sure, specifically if there are any coming up, but a lot of those are usually sponsored by hospitals, or other associations, and they are starting all of that back up again. So.
And I think that might, okay, full disclosure, when I went for my mammogram a number of months ago, they were telling me how busy they were because of the months that they were closed, and just wondering if there's more appointment opportunities open, because I know that I had to kind of wait on mine a little longer than I'm normally used to. So.
And again, that depends on the institution, wherever you're having your mammogram done, but there are some radiology facilities that are actually opening on Saturdays because they're so busy. So yeah, but you just have to, call the facility and see if that's an option at that one.
Okay. Another question is, did cancer patients experience worse COVID-19 symptoms than the general public? So if a cancer patient did get COVID, were their symptoms worse?
Not necessarily, no. It was interesting because I had, and these are just anecdotes, but I had several patients who, had a lot of risk factors, elderly, on chemotherapy with cancer, heart disease, blah, blah, blah. And they've been on treatment for a long time. I have a couple that I'm thinking about in my head recently, both married, and they would come in with their spouses. They got COVID and their spouse got COVID, and their spouses were healthy, and their spouses ended up dying, and the patients survived. So in some respects, there's like no rhyme or reason, which is really what made COVID so scary, is that, you would have somebody 30 who would die, and you would have somebody 80 years of age who didn't even have any symptoms and didn't even know they had it. But in general, know that if you had cancer and if you were on chemotherapy and immunocompromised, you did not necessarily have worse symptoms. I had plenty of patients who, it kind of blew me away because they are so fragile and they had COVID and they didn't even know they had it. They may have had a little fever and then the fever went away and that was it. So.
That is so interesting, because I think we all expected that we were really, and still are, protecting our cancer patients here. And so that's interesting how it's all worked out. And again, it's such a big question on age and everything else.
And it sounds like it just depends on the particular body.
Yes.
Okay, we do have one more question, and if anybody has additional questions, please send them my way while I am doing this last one. How is that? And then we may give back everybody a little bit of time for their day, which is always a good thing. So the question I have here is, when do you think we will start seeing the long-term effects of COVID on cancer care? I know you talked a little bit about that there's still a lot of unknown. But I think I heard on an American Cancer Society webinar, they talked about, 10 years. This could be, an effect that we're seeing for the next 10 years. So what are your thoughts on that, Ann?
So, obviously I don't know for sure. I can say that right now, myself and my colleagues are seeing more cancers being diagnosed that are more advanced. And, it's still early after this whole pandemic. We're really just now, getting vaccinated and kind of trying to get back to some normalcy. But, I would say that in the next year, we will really see an impact. I think that's when we'll really have more cancer diagnoses and, we'll see more cancer death. But it really is going to go on for years. And there's just no way to know in all the different ways that it's going to impact. But the most worrisome is that it's going to ultimately increase cancer mortality, which will be the first time that that's happened in ages.
That is so utterly sobering, because we celebrate how survivorship has changed over the last few years. And I think you mentioned leukemia earlier in our conversation, and I can recall as a child having a childhood friend who was diagnosed, and her father too. And at that time, leukemia was just not survivable, and they didn't survive. And now, leukemia is so survivable. And so, that the thought that we're going backward on the survivorship advances um, is really difficult, because, as I well know, that leaves more loved ones without their person, and that just breaks my heart. And I know I talked to our counselor the other day, and she mentioned that the majority of the counseling that she is doing right now is grief counseling. And that's unusual. Usually I've just been diagnosed and I'm having trouble processing, it's more in the moment. But she's, because of the loss that's happened over the last year, most of hers is grief counseling. So it's it's sad to know that will continue, and I hope it doesn't continue too long. And as knowing what we do for cancer patients and their families, we're also trying to figure out how we need to ramp up to be ready, for this onslaught of newly diagnosed patients when they come. And so that's something that we talk about as a staff and as a board, is what do we do to prepare for when, we kind of call it the diagnosis tsunami sometimes, when that flood of people, how do we get ready, and how are y'all trying to get ready?
Um, you know, we're trying to be able to continue telemedicine. Honestly, that's a big way. It's very complicated because it's not like Texas Oncology. Texas Oncology can just say we're going to continue telemedicine. We've got to have Medicare supporting that, private insurers supporting that. But that's really one huge way that we can stay in touch with patients. And, we can even see patients for their first visit via telemedicine, if it's a new cancer patient, and then order all the tests that we need. And then they go have their tests, and then they come back and we go over everything. So, telemedicine is one huge way that we feel like we can handle a larger amount of patients coming in. And then other than that, I don't know that there's a whole lot more that you can do to prepare. It's just that when the time comes, you have to be willing to, like open on Saturdays to get, all of the radiology done, just things like that. So it's a work in progress. It is very imperfect. The whole thing from the very beginning has just, been day by day, figuring things out, and things change from day to day. So it's hard to, be 100% prepared. But we know so much more than we knew a year ago. I feel like we're in a very good place. I feel like we can continue great cancer care and screenings and, keep people safe. So again, if there's a takeaway from this, it's that we need to get our screenings done. And we need to start now. It's been a year, we've had a year lapse. So if you haven't had your screenings, you need to go get them now.
Well, I think, yes, I hope everybody will do that. And just as you talked about, telehealth, the reason why we can do this today is because we've all learned how to communicate virtually. And just to have the opportunity to be with you, Ann, and to all of you who are watching today from your laptop or your telephone or your iPad. And yet, you didn't have to come to an office. You got to just hear this great information from an oncologist wherever you are. So I'm proud that the virtual world now is something that we've all become accustomed to, some kicking and screaming, but here we are today. This is a great example of how we can connect with each other virtually. So Deanna, any other questions?
I have two more questions. I have one for Ann and one for Melanie. So one of them is, you've given us so much great information today, Ann, and thank you for that. But is there a good place beyond this for people to get more information on COVID effects on cancer, like a resource or a website?
Well, American Cancer Society is always a great resource. We also have in oncology a society, it's called the American Society of Clinical Oncology, or ASCO. And they have great information on their website. So those are typically the two sites that I recommend for information. You can always go to the CDC website. Sometimes it's difficult to navigate through. There's like an abundance of information. But I think the ACS and ASCO, I think those sites are really good.
Okay, great. Thank you so much. And then for you, Melanie, one of the questions was, how do I contact Cancer Care Services for help?
Oh, that's a great question. Well, we are available in lots of different ways. So you can call us at 817-921-0653. You can email info@cancercareservices.org. You can go to our website and there's a form that you can fill out, and that is cancercareservices.org. And you can even go to Facebook and search for Cancer Care Services and send us a DM and let us know what you need, and we'll call you back. So we're accessible in a million different ways. If you want to walk in the building, we're being very, very cautious. And we're right now at 50% capacity in the building, but everybody is, if they're not in here, they're working remotely. So that's a possibility too. If you're at one of the health facilities in the medical district and you want to pop in, we'll be here. But if you want really fast, great help, you might pick up the phone or send an email to us and we'll call you right back.
Perfect. Thank you for doing that. So we just want to say thank you to Dr. Ochs for all of this amazing information, for being part of our board, for just being part of our Cancer Care Services family. Thank you so much for that. And as always, Melanie, our amazing CEO, visionary leader, head honcho of Cancer Care Services. It is fantastic to work alongside you every single day. So we would just like for everybody that's on today to know that, we would love to have you come to a Cancer Care Aware tour. Reach out to us. Those tours are on the website as well, or just give us a call and we'll get you signed up to hear more about our story. And we want everybody in our community to be Cancer Care Aware so that everyone knows about our services and our programs when you hear you have cancer or someone you love. So thank you all for joining us today, for participating. Melanie's holding up her finger. Yes.
One more thing I forgot to mention. All of our programs and services are provided at zero cost. So if you're listening and you've heard all the things like counseling and play therapy and camp and all these things, and you think, but my cancer has already affected me financially, I can't stretch one more penny, you will never get a bill from Cancer Care Services. So I wanted to make that a real clear. Everything we do is provided at no cost. So there should be no reason why somebody shouldn't give us a call and let us help.
And that all happens because we have a very generous community here. So we thank everyone for your support of our programs and our resources. And we hope everybody has a great rest of your week. That we will have another Just the Facts that we are planning for September. So thank you for joining us, and we will see you all again soon.
Thank
Have a
you.
good
Thank
day.
you, Ann. I appreciate you. You did a wonderful job. Thank you.
You guys have a great day.
Thank you, Ann.
Bye.